Good evening, Peter Goertz. I'm a psychiatrist. Do you wish you could control other people? Sometimes I, and probably some of you, have trouble controlling ourselves. So, in general, in my opinion, it's not possible to control other people. And specifically, it's not possible for doctors to control patients for any length of time, or at least in the long run. And I'm talking about both medical and psychiatric patients. And this is a significant issue because if one believes one can control people to a large extent, that can end up leading to quite a bit of frustration in doctors who may believe they can control patients to a large extent. So one example that I was quite surprised by is I read about a doctor, an internist, who did not accept any patients who were smokers. So I thought that was interesting because you really, if you do something like that, you exclude a large amount of patients. And in general, what I've tried to do over the years is to be as open-minded as possible and accept patients if I believe it's possible that I can help them. One example is quite a few years ago, I had a patient who for decades had been using heroin, an older gentleman, and he was depressed, and I felt he might benefit from an antidepressant, and I prescribed one. And he was a patient of mine in the clinic for some time, and another way of looking at that situation might have been for another doctor, oh, he's a heroin user, chronic heroin user, and he doesn't belong in an outpatient psychiatric clinic. He needs to go to rehab. But of course, he didn't want to go to rehab. As far as I recall, he had been in rehab in the past, but at that point, he did not want rehab. That's one example of someone who can be helped, in my opinion, even though they're chronically using a drug. And often it can be frustrating for doctors if patients do not take their medicines, but we have to be accepting of the fact that many patients do not take their medicines. So that's one thing. I was blindsided by that. I'm thinking of a specific patient because I was thinking, oh, this medicine hasn't worked, this medicine hasn't worked. And then the patient told me she hadn't really been taking her medicines consistently. So that can explain quite a bit. So of course, it would be great if all of our patients adhered to a great diet, exercised optimally, did not smoke cigarettes, did not drink alcohol or use any drug, engaged in a helpful spiritual practice like meditation, for instance, yoga, tai chi. It would be ideal if they had good housing, if they were financially secure, if their stress level was low, if they had fresh air to breathe around them and healthy water to drink. That would be wonderful. But unfortunately, many of the patients doctors see do not meet those criteria. And there can be various reasons. For instance, with diet, a good diet can be quite expensive to buy. So good food can be quite expensive. Many patients in the US get food stamps. And when I go to the grocery store, I'm quite struck by how expensive, for instance, fruit is, and avocados, for instance, are very expensive. Meat is very expensive if you want to buy good meat. Exercise can be difficult for patients sometimes due to medical problems. That can be like going in circles. Living in a good neighborhood where they're not under constant stress and feeling unsafe can be difficult for patients because of money. If you're a psychiatrist who sees patients in prison, that, of course, can be an environment that's very stressful for the inmates. If someone's using alcohol or drugs, that may well interfere with treatment. does not, in my opinion, have to mean that the patient cannot see you at all, that you cannot help the patient at all if the patient does not want to go to rehab. And another aspect to think of, in my opinion, is our American culture, because we tend, at least a lot of people in our culture, tend to want a quick fix. For instance, if you have a headache, take Tylenol, Advil, Motrin, and hopefully the headache's going to go away. So that approach is very common, as opposed to when you have a headache, thinking, what could be causing that headache? Why do I have a headache? And looking at, maybe I'm constipated, haven't had a bowel movement for 3 or 4 days. That could be one example of a reason potentially for having a headache. So we want to look at our general cultural approach, our individual approach as doctors. It often can be very helpful to look at roots. And similarly, with psychiatric issues, you want to, as much as possible, understand what roots, if there are any discernible roots, what roots there are for patients' psychiatric difficulties. Thank you.